inform you on the importance of taking medication as ordered and as prescribed by physicians. Being a nurse in the healthcare field, I've seen the ups and downs to many residents that have overused medication and underused medication, which are both dangerous. Taking medication for an extended period of time and on time can cause your body to become adjusted to the medication, which that's what we would like for your body to obtain. The normalness of medication and the effectiveness of the medication. I've seen many cases to where a patient has taken medication as prescribed and has done very well. I've also seen patients that have taken medication as not prescribed and they had many side effects or problems to this medication. Give you a scenario, such as Sally. She has hypertension, which is high blood pressure. She was prescribed lisinopril, which is a blood pressure medication, 5 milligrams once a day by mouth. Now, Sally takes her medications in the morning as prescribed, goes on with her day. Then she decides she wants to skip Tuesday and Wednesday. Because of her not using her medication as prescribed, this can cause for her next appointment with her doctor. Her medications could be adjusted to where it fits her diagnosis needs. If her blood pressure becomes even higher, she'll be put on a higher dose of medication, which can cause her blood pressure to bottom out, which means her blood pressure drops. It can also cause for her to have anaphylactic problems, such as allergic reactions to certain medications. And this can be anywhere from the throat closing up, diarrhea, constipation, and even dizziness. So, readjusting medications is very hard as far as for your body, because your body can only take so much. Now, overusing medication is also very dangerous as much as underusing medication. Over medications can have many effects to your kidneys, your liver, and also your digestional system, such as your stomach and your intestines, which can cause ulcers, liver disease, and even liver and kidney failure. I'll give you another scenario. Sally taking her same lisinopril, 5 milligrams, once a day by mouth. She decides that she takes her medication as ordered during the morning time, which is fine. She doesn't have any problems at all. Later on in the day, she gets a little dizzy. A side effect to hypertension is dizziness. So she decides to take another 5 milligrams of lisinopril, thinking that it's her blood pressure that's slightly high. Little does she know her blood pressure wasn't high. She could have stood up too quickly, which can also cause dizziness. Or she could have run a 5-mile run, which can also cause dizziness. She takes that extra 5 milligrams in the afternoon, not knowing her blood pressure is already low, and it can cause her blood pressure to bottom out. Now, we have the unresponsive patient, unconscious, blood pressure low. Being that her blood pressure is low, now we have to take medical needs as far as in bringing her to the hospital and allowing her to restore her life, so to say. So under usage of medication is dangerous, such as overusing is dangerous. Underusing can cause problems such as readjustment of medications, adverse reactions to medications, and overusage can cause anywhere such as a beefsteak, which you shouldn't eat while you're on a lot of those medications because there's a lot of fat in there. But it's very important for you to monitor patients such as the elderly and the kids with medication because of the simple fact elderly people are very unaware of how they should take medications. When an elderly person thinks they're having a problem, they automatically wants to take more or less of medication. So they should be observed, especially residents that has Alzheimer's and also dementia. Kids are not familiar as far as for measuring for medication. That's why they always should have an adult or an older person to give the medication so they don't obtain more than enough medication that they need. But my informative for you is to make sure that you take your medication as prescribed. Taking your medication as prescribed will save your life and will save you from any other complications you may obtain. Thank you.